much about it, that nobody did much about it. And some of these individuals sort of found their way to become better people, but quite a number also never got better. He's the recalcitrant guy in school. If there's anything that people are being lined up to lash, that guy is part, that girl is part. And we were like barely teenagers then. So should schools be paying attention to what constitutes a child or an adolescent's mental health?
Yeah, great. Good morning to your listeners. Dr. Pell here. Shout out to everyone who's making a move this month for their mental health. Yes, it is very essential that we pay attention to the mental health of young people, children. And yes, we've been making efforts with the Ghana Education Service, with schools that reach out for assistance because it is critical. There are formative years of our lives when our mental health is very delicate and it is vulnerable and susceptible to parenting style, correction styles, peer pressure, nutrition, and belongingness, neglect, and abandonment. It is very susceptible to all these things. And so in the preschool years, mental health is essential, and schools that are dealing with preschool children need to have some relationship with a mental health professional to help them see the areas that they need to be awakened to. Those who are dealing with adolescents and teenagers also need to have contact with mental health professionals. We as a department too, we make the effort. We get referrals from schools asking for us to do assessments for the children.
Okay.
We have, Caleb and myself are going to child and adolescent mental health. We have psychologists who are also in child and adolescent mental health. We have tools that we use to assess children. So whatever sign or symptom you are recognizing, like the child who is being obstinate, doesn't appear to listen to advice, that child who is being oppositional, who is doing the opposite of what you ask, that child who is not able to remain seated when it's required to do so, and it's all over the place, that demanding child, and that child whose emotions are out of control. You hear parents and teachers complaining, as for this child, when she begins to cry, if she's not done, there's nothing that can appease them. These are all the telltale signs of children's mental health that we brush over. And these are signs that need to be brought to the attention of professionals to guide you. Because from where we sit, as the brain gets the right conditioning and the right environment, you should be maturing towards making the right choices.
Okay.
So if from the onset, with all the right turnings, you get motivated when you do the right thing, you should be veering towards the right conduct. Okay. So if you find a child deviating consistently, then it should be telling you that this child is not learning the lesson. Okay? This child is not picking up as he should. And so then you need to get that child assessed. And like I was saying, we get referrals from all over. Unfortunately, most of the time, the referrals come for those children who say the school is like giving up on them, or parents are, struggling to get them into a school.
Well, Pearl, not to catch you, but the reason why I wanted us to start this conversation about mood disorders from children is because I feel this is just a feeling. This is not a medical thing. This is a feeling. I feel that a lot of this starts very early, and nobody seems to, I don't say catch it, but nobody seems to be paying attention. So by the time the person is an adult, it's like we say in Chi, they say are not here. And then it becomes formed.
Yeah.
I hope it's not a wrong feeling.
No, it's an empirical observation. It's the beginning of the scientific systematic process. And that's actually how it should be. Caregivers, parents, guardians, babysitters, everybody should be aware of it. In fact, from the time you lie in your cot, you have come with your temperament. You've come with that innate person who you are. And the people around you are your students, okay? Because at that point, your communication is non-verbal, okay? So your language is primitive. Crying is your first language. And so the crying, those who study children's cry will tell you that the cries differ depending on the need. So if I've soiled myself, it's a whole topic. If I've soiled myself, my cry is different. If I'm hungry, my cry is different. If I'm upset, my cry is different. If I just want you to pick me up, my cry is different. So like you're saying, from the very beginning, day one, the people around you are supposed to be learning how you are, so that latest by 2 weeks, 3 weeks, you should be able to say, this child has this temperament. And when you hear this cry, as the primary caregiver, you should be able to figure out immediately what the challenge is. Now, when you find that the baby you are dealing with, the clues are so disorganized. The clues are disorganized, okay? You are not able to distinguish what the needs are. That is your first red flag.
Okay.
And a lot of parents, especially first-time mothers, because they get overstimulated, they get fed up. And then they just say, oh, leave that baby alone. You know, this one.
Interesting.
And that's where it begins to deviate. That's where we go wrong. Because from that point, we start labeling the child. And it worsens the frustrations of the child.
All right. If you're just tuning in, this is 107.9 Orange FM. Let me repeat the severe weather warning that we have. So the Ghana Meteo reports that there will be a severe storm this morning. Supposed to start at 9. Seems to have started already. So if you have not left home yet, if you don't have anything critical to do in town, stay home and enjoy the weather. If you do, make sure you're protected. If you're driving, turn on your fog lights or turn on your daytime roaming lights so the oncoming vehicles can see you. And that's the warning from Ghana Meteo. It looks horrendous out there. Stay safe if you're out there. This morning, our conversation is on mood disorders, and I'm joined by my good friends Caleb and then Pearl. They are all doctors, so I get to call them by their first name. And this morning, we're talking about mood disorders. Extremely important topic, and I've intentionally started from children because we seem to get it wrong from the get-go, and it becomes a problem. Caleb, let me ask you. So, what constitutes a mood disorder? Like, someone said mood disorder is mood swing. So, what is a mood disorder? So that people know what we're talking about.
Right.
Yeah.
Thank you very much. So, generally, mood disorder in simple terms is a mood swing? It's just one of it. It's basically dysregulation, if I'm allowed to use that word, of mood to a significant extent. So dysregulation of mood. When I say dysregulation, mood swing is just one of them, but it's not just any mood swings at all. But you could see that this one, it's a bit gone on for a while. It's a bit discomforting, it's distressing, it affects the person's functioning, it's a deviation from how the person used to be, and sometimes it can get so high that the person even is at risk of danger to themselves or to others. It can get so low that they're also at risk to themselves or others. So generally, I'll say an overview of what we say mood disorder in mental health. You know, we could have what we call subclinical, like low levels of it, which may seem, I would say, benign. Like it's basically able to function with it. It's gone on for so long. It's basically it's likely to realize that no, it's not. I'm not in the, for lack of a better word, usual normal range of mood that's supposed to be. For instance, someone can be what we call dysthymia, as we go low mood, but seems to be still functioning, going out there. But deep down, they are not happy about life, lot of things.
But okay, so, and I'm asking this because there are. Can you classify that somebody has a mood disorder, even if it's temporal? Like, okay, so let me use myself as an example. I have lost my brother. For like a few days, I was like, no, Charlie. I had a lot going on in my mind, but I was functional. Yeah. Is that a mood disorder?
So
let me diagnose.
So that's what we call grief as well. Grief is a normal response to loss, but the issue is like the criteria I said earlier. When it gets to a certain point of duration, grieving for so long, 6 months, 1 year, the intensity of the grief, to the point of probably unable to do anything at all for so long a time, to the point of feeling so distressed, disturbed, crying all the time, not eating. When it's, say, about a week to maybe a month, it's to a few weeks, it's fine. But when it prolongs, 6 months and over, and it seems to be still going on, we have what we call pathological grief. So we have grief is normal response to loss, to what we call bereavement. But we have prolonged one, which makes it a problem. Sometimes it may even go to the point of, when you lose a loved one, like you're saying, some people may occasionally, within first few days, 2 weeks, be hearing something like the voice of the person. But when it goes on considerably, what we call hallucination, when it goes on that long, it could be very into pathological grief or some other. So the grief, in this case, the loss will just be a trigger for another full-blown condition or disorder. So you have grief and you have pathological grief. Yes.
Okay. So it means that the classification of something being a mood disorder is dependent on the duration, the time.
Yes.
Is dependent on the time.
It's dependent on, one, the duration. It's dependent on your functioning as well. And it's also dependent on your baseline state. Okay. So there should be an obvious awareness of a change in your normal state. Okay, so you have a normal range, and you detect that you have gone either below or above your normal range to begin with. And then you recognize that the duration of the symptom has to also be significant, because we understand that these things we are talking about your emotion. And your emotion has a center on your brain that is responsible for its control. And there is a physiological component, or there is a biological or body aspect to what you are feeling, that emotion. And there's a normal timeline that your brain, reacts to. In this case, the trigger, which is the loss, There's a normal timeline that we know your brain will lead your body to react to it. Now, that reaction timeline usually is what guides the timeline that we use to determine that you have gone beyond the normal allowed time span. So when you've gone beyond that time span, then now we say now you are in the abnormal range. So you are in the pathologic category. So If it is loss of a loved one, then now you're experiencing pathologic grief. And the other component that gets affected with this dysregulation is your functioning. Okay, so it incapacitates you, and the incapacitation may not just be physical activity incapacitation, but it can be cognitive functioning as well. So you would realize that you might lose your capacity to concentrate, to sustain your attention, to solve problems, to organize yourself. So you can become disorganized, okay? And then you can have the physical experience of a decrease in your energy level, okay? So in the energy level, you can either have a decrease or you can have an increase, okay, in the energy level. So you notice that we've talked about a dysregulation in your emotional state, a dysregulation in your time for reaction, your reaction time, a dysregulation in your energy level, and a dysregulation in your functioning. So these are the areas that mood disorders impair your functioning.
If you're just tuning in, this is 107.9 Orange FM on a very wet Saturday morning. And we're talking about mood disorders. How has your mood been lately? If you're listening to me, have you been happy? Have you been sad? Have you been, like Dr. Pearl just said, disorganized, like Caleb said? Are you experiencing something that is going on for an abnormal period of time? I'd like to hear from you. Send me a WhatsApp on 0548 501 584, 0548 501 584. Send me a WhatsApp. It can be a text or a voice note. If you're watching us on YouTube, you can also put your comment there about, I just want to find out, whilst they were talking, someone sent me a very emotional message, and what he's saying is that he's saying that for him, it is almost impossible for him to be happy, and he wants to find out whether that is a mood disorder. Like he's saying that it's almost impossible for him to be happy. Right. I find that very strange. Right, so very little gets me happy.
So I'll say I'm sorry about how he's felt for this long, but help is available. Yes, okay. Definitely. If it were once a while, due to one situation or the other, but to be expressed this way, yes, please, we would love to have a conversation with him. It is possible. It could be what I'm talking about. If he's going about his normal functioning and all that.
Oh, Caleb, we are men. You see, men are, like my friend would say, we are functional beings. Like, no matter how it is, like, you will push through. So maybe, I'm not sure, I know he's listening, you can send a message. Like, are you able to function?
So when I say that, I mean, sometimes it can be very profound, but the person will still function.
Okay.
Sometimes it can be quite subclinical or small, the person will still function. But in the midst of the functioning, the person can still feel so down that by the time you realize the person has gotten to that extent that we always want to avoid, which is that life is no longer worth living kind of way of thinking. And that's what we want to avoid. That is why once you are functioning or not, if you are really feeling this way and it is clear that you can never find yourself happy, difficult for it, like he's expressing, we will want to have a conversation with such a person and see how we can help. Definitely there will be one way or another to help. I was going to add this earlier to that. Sometimes people can maybe in the spur of the moment act out.
Yeah.
It may look once a while, but if you realize that every time something happens, you burst out, then you've been fine most of the time. Then when it's a trigger, you realize that looking at the context and whatever happened, the response was disproportional. Someone will call it maybe anger problem. Maybe that is yours. Just you will still need help to be spoken to, because that anger burst out can end up with consequences that may be very damaging. we will converse with you and we'll know whether this is the beginning of something worse, or you probably need what we call anger management or some other thing. Sometimes something may be troubling you deep down, but you are not being able to express it or get help to address your emotions about it. And therefore you realize that what you call tantrums, it happens quite often in children too. Sometimes you may think, oh, like you're saying, son or tear, but it could be the beginning of something or one feature of that
something.
Yes, please. So it all comes, and one thing, I don't know, maybe we talk about that one, too, how it presents.
Yeah,
Children, a lot of times, maybe this tantrum, that may be what they are presenting as their mood disorder, probably tantrums. And you realize that looking at the age range and then what caused the tantrums, it's definitely not the usual for that age. Don't see sign or tear. Let's see the child. Conversation with the person.
Pearl, do we have symptoms for mood disorders? Like Caleb just said, like for children, you see, like they are like tantrums, acting out, sign or tear, akwawe de ni timya ne de, omua de, bibi kakre na ni buefu. Do we have, like for adults, for instance, do we have symptoms that you see and say, mood disorder?
Yeah, we do have symptoms for mood disorders. And here I want to say that we have different mood disorders because our emotion is a spectrum. It begins, you could say, from when you are at the lowest point, that's the sad point, to when you are at the excited point, like, you are through the roof. And it is a continuum, okay? So the disorders also happen to be varied along the continuum. So the lower end is where we have the depressed type of mood disorder. And then coming up, you can maybe say you have the euthymic state, okay, which is that you are balanced, you are here and there, and at the right time, in the right proportions. That's the ideal. Then we have the hypomanic, which means that you are slightly excited, okay? There in that state, there are two cardinal symptoms that you'll not find, okay, which would be that you would not be having perceptual disturbance. And by that, what I mean is you won't be hearing voices when no one is speaking, and you won't be seeing things when there's nothing to be seen. Okay, those are the cardinal things. But in the hypomanic states, there is a dysregulation that makes you overgenerous. Okay, it's like you are a bit excited, so anything you have, you give it away, which is a symptom very classical of the hypomanic state. Then we have the manic states, which is also a type of mood disorder. Then we have other forms, like we have cyclothymia, and just like the name goes, it's like your emotional experiences are changing at a very rapid state, okay? And then we have the very, very chronic form of the dysregulation, which we call the dysthymia, okay? And this one can be with you for years. So we have different types of mood disorders. And for each of these, there are symptoms that are recognized to define each of them.
No, just a minute. I'm asking this because, one of our learned colleagues, one of our colleagues is saying that we have to break it down to we have to try and do a lot of non-medical jargons. We will struggle and try. We will struggle and try. But I'm asking this because, you see, usually I tell my panel, I like to spend a lot of time on the symptoms because people listen and they're like, this thing that these people are talking about, let me do an introspection and find out
if I do have it.
If I do have it. Yeah. And when we have these conversations, some people that I know, and also some will be texting and saying, no, ask them to repeat this, because mood is
your emotion.
Yes.
Yeah.
Like, for want of a better word, like emotion. Yeah. So it's a mood disorder equivalent to someone who is very emotional.
Okay.
Like,
Yeah. So we are talking about you having. We are talking about you having a mental health condition that affects broadly your emotion, and it does not affect your emotion alone. It affects your energy or your experience of your energy states. It affects your activity state as well, okay? And then lastly, it affects your function, okay? And under the function is where I mentioned that your physical functioning, okay? Your mental functioning, so your mental functioning, so your ability to organize yourself, your ability to solve problems, your ability to plan, okay? And so in talking about the symptoms, depending on which type of mood disorder we are talking about, which I'm hoping we are going to be doing now, you'll be able to determine which one you have. So let's say we are starting with the mood disorder that we refer to as depression, okay? Depression, in these 4 areas that the dysregulation will occur, what you will notice is that in the state of your emotional states, you would have low experience of emotion. So you'll be feeling sad, okay? You'll be feeling unhappy, or you'll be feeling lack of pleasure, okay? That is one symptom of depression. And like we mentioned, there's a duration to it. So you may have been feeling sad. It should be continuous for at least 2 weeks. And for some people, it might start erratic. So you wake up in the morning and you feel sad. And we want to emphasize that most of the time, you will not have any real reason why you've woken up feeling sad.
Okay, so you wake up, you are sad.
Yes, you are sad.
Hey.
You just woken up and you are sad. So that's why we lay the preamble of 1. It is not like your normal self.
Okay.
And that has to do with the emotional experience that we are talking about. And when we say mood, we are looking at a dysregulation which mainly affects your emotional state, but it goes together with other aspects of yourself, which is your energy state, your activity state, your functioning states. And in fact, the functioning state is the icing on it. Once you get to the point where you've lost functioning, we say you are in the moderate or you are in the severe category, okay? So that is why the question the statement you made earlier on, that a lot of Africans are actually bulldozers, okay? They might be flat, but they will still be pulling through. So in my practice, I've learned not to be looking out for the loss of function, because a lot of people are walking around with one mood disorder or the other, but they've put on a face, a front, and they are going and coming every day. And that is the very dangerous state, because it's like, I always say, it's like you have an ulcer which is healing and you are rubbing it. Okay. The scar will be very nasty. So the day that something small will now lead to a very catastrophic state. So we don't want that. So the loss of function usually comes when you are in the moderate and in the severe states. So the primary, early symptoms will be a disturbance in your emotional state. So with depression, I've mentioned a feeling of sadness or low emotional state, being unhappy, and usually you can't really pinpoint why you are feeling that way. Like in your case where there's an obvious reaction to loss. So you haven't lost a loved one, you haven't lost your finances, you haven't lost a contract, you haven't lost a patient. You don't have these physical triggers.
Like you are sad for no reason.
You are sad for no reason, basically. If you have these triggers, then that's where the timeline we mentioned That's why we are looking at pathologic grief. So you have a physical loss and you've been unhappy about it for more than 6 months. It is past the physiological response time that you should experience this low emotion. Then you are now in the pathologic category. And then, hey, you are probably on board with a depressed mood disorder. So the first symptom we've talked about now is feeling sad.
It's feeling sad. Like a
unhappy.
feeling of sadness,
unhappy,
unhappiness,
not
feeling low.
Feeling low, feeling
low.
down.
Okay, feeling down.
So
okay.
that's the first
symptom.
One.
Just before you go on, if you want to join the discussion, send me a WhatsApp on 0548 501 584 0548 501 584. You can send it as a text or you can send it as a voice note. Before you go on, Caleb, let me ask you something that someone has sent in. He's asking about things like anxiety, whether being anxious about things can be classified as a mood disorder. He's asking about anxiety. His message reads that usually he's anxious about things at work. He's saying that my work requires a lot of detail, and sometimes when I need to give feedback to my boss, I'm very, very anxious. Listening to you, I'm wondering whether I have a mood disorder.
All right. Once again, I would say, so in lay terms, anxiety is an emotion. In lay terms.
Okay.
But in mental health terminology, we put it under what we call anxiety disorders. So I will maybe say, as an anxiety disorder, we have different types too.
Okay.
Yeah. Sometimes, once again, anxiety is a normal emotion, like on its own.
Yeah.
Good. But then, once again, when we go take you through these 5 C's we were mentioning, beginning mild, affecting other things, duration, triggers, and all that. In this case, he's identified it as when he's about to give feedback to his superior.
Boss,
Is that only that? Is it that the only situation? That's one thing we want to know. The level of anxiety, does it get so bad that he can't even talk? Or is it just his heart beating, hey, have I done right? Have I looked at anything? Because anxiety, even for exam preparation, normally, there is a level of it that, in fact, is shown research that you need a little amount of it to prepare adequately. But you shouldn't get to that level that will now interrupt or interfere with what you are supposed to do. Good. So maybe he will need, if that's the only context within which he has this anxiety feeling, he may, once again, like I said, just pass to have a conversation to see if there's a need for help. Because there are some simple techniques that we use to help people. Some people, it's just when they're going to have a presentation. Some people, just a rehearsal before will help reduce the fear. Some people, we have a deep relaxation techniques before the exercise will help. Once again, after the conversation, we get to know whether one of these will help or something a bit more will be added to it.
So you see, from the feedback that I'm getting from a lot of the texts that I'm getting, there's a layman's understanding of what a mood is.
Exactly.
And there's a technical understanding of what a mood is. And the two sort of mix up. You know, sometimes when you're feeling low, today I'm depressed though. Or I feel low. So we use the words loosely in English. So
it gets us confused.
Yes.
In fact,
it's very confusing for people because someone is just asking that he's saying that the most popular term or the most popular mood disorder in Ghana now seems to be bipolar. Yes. You know, so we have these broad ideas of what these things are. So someone does something small and say, oh yeah, we do a bipolar for now. And then like we sort of write it off. Full stop.
You know,
Are we right?
no, we are not. Because you know, when I was coming here, my first thoughts of how I would react to if you asked me what a mood disorder was to make the statement that this is the class of mental health conditions that is most misunderstood and most, what should I say, abused or traumatized mental health condition. Because, like you rightfully said, we mix it up. It's like the problem we had with malaria. Anybody just comes to the hospital and say, "Oh, I think I have malaria." And when you ask the person, "Have you tested? Tell me what your symptoms are." They will say, "Oh, menya malaria, that's why I've come." It's the same way with mood disorders. You see, mood disorders, even though the name talks about the disturbance in your emotion, you see that we've outlined 5 areas that the disorder affects. And even now, we are veering into another class of mental health disorders called anxiety disorders. And it is very important to note that a lot of times, anxiety disorders, when not attended to, can actually lead you to develop a mood disorder, and very often a depressed mood disorder or a manic mood disorder. And like I explained, that the mood disorders, the bigger groups are the ones that I talked about: the depression, the hypomanic, the manic, the cyclothymia, and the dysthymia. These are names. We don't have the tree equivalent, so we apologize. But when we say someone is depressed, we've mentioned that there is a feeling of sadness, and the timeline is to have experienced it, not have any tangible reason for experiencing it for at least 2 weeks. Then there is a feeling of a decrease in your energy level, feeling like you do not have energy for any activity, okay? When it could be even at when you woke up in the morning, and that might present itself as you feeling, out of sorts, which we will say lethargy. So you don't feel like doing anything, because you feel you don't have the energy for anything. So we say, get up and go and bath, and you're like, oh, let me be. And this weather is very, very popular with feeling that way. In fact, there are seasonal variations to this experience. If you end up in countries like Sweden, where the daytime is so short, it can predispose you to this kind of experience. So a feeling of low energy, okay, is one of the areas. The second is losing interest in things that previously brought you interest, okay. So I used to love to listen to music. When you are feeling depressed, the joy of listening to music will be gone. I used to love football, but now even the most fierce match will not excite me anymore. So things that you used to enjoy doing lose their interest. These are the 3 core signs that you experience if you are having depression. Then there are other non-core symptoms, which would be a disturbance in your sleep. So depending on the age of the person experiencing the depression, if it's in children and people with extreme ages, they might be oversleeping. So they sleep more than usual, okay? Or for those of us in the middle scope, you have decreased sleep. You struggle to fall asleep, and then you wake up earlier than you intended when you sleep. Or you can completely lose sleep so that you don't sleep at all. That will be one feature that could add to the first 3 that I mentioned. And then a change in your appetite or eating habit. So you don't feel hungry, okay, or you don't feel for food, and so you are not eating. That is also a sign, a symptom as well that people with depression would have, okay. Then we come into the other brain function symptoms, like when now you begin to feel that there is something wrong with you, okay, or you have done something wrong, feelings of guilt, okay, and nobody is aware that you've done anything wrong. You yourself, you can't really say what you've done wrong, but you feel strongly that you've done something wrong. And in extreme cases, you might start going around apologizing to anybody who you feel you may have
offended.
And then beyond that is where you now begin to feel that there is no hope, there is no help coming. You feel like you are in a vacuum situation. You are in a situation that seems to have no promise. Okay. And when you are having these three symptoms I just mentioned, you are in the moderate to severe category. In fact, when you have the 3 core part plus 3 or 4 of these other symptoms, we say you are already in the moderate category. So if now in this state, now you see that your functioning is now affected, your concentration is impaired, your attention is impaired, your memory has lapses, so you are becoming forgetful. Along with these symptoms I've mentioned. So even in some situations, you are no longer caring for yourself, because you don't have the energy, you don't have the pleasure in doing it, and you are not happy, okay? Then now you are in the moderate category. And when the feelings of hopelessness, helplessness, loss of function comes in, and you are even beginning to feel that your body is decayed, or you are a dead person walking, and you might see this in your dreams, okay? And then you might even begin to have the idea that I'm better off dead than alive. We say you are having suicidal ideations, okay? Then now you have shifted to the severe category. And in this state, you can begin to now hear voices. You can begin to now see images of dead people, dead relatives. You yourself, in your dreams, you see yourself in a coffin, you are being buried, or in your dreams you are falling, and you are never getting to the abyss of wherever you are falling.
So if I'm hearing correctly, then it's a spectrum which you need help for. Someone asked an interesting question. I'll put it to you, Caleb, later. So I guess that, like, so it's a spectrum. Like, when you go to the hospital, or when you see a psychologist or a psychiatrist, you need to let them know where along that spectrum that you probably are.
You tell us your symptoms.
Okay.
And then based on your symptoms, we'll be able to say this is mild. Okay. And if it is mild, then the management might be simple. You might just require psychotherapy, which is someone creating the environment for you to discuss your experience and teaching you some techniques to help you, get out of the physical processes that are underlining this dysregulation and come out of it. Now, if you are in the mild category, I must say you are still functioning, but you're experiencing maybe 2 of the core symptoms and maybe 1 or 2 of the additional symptoms, okay? But you are not having any hallucinations, any delusions. You are not feeling helpless, hopeless. You are not feeling like dying. Then you are in the mild. You are just unhappy, like our guy said. But in his case, it sounds like he's in a moderate category, because he says he's never, ever. That's quite deep, okay? So if you're in the mild category, you are going and coming. If you don't tell anybody, nobody will really notice it. And that stage is actually a good stage with good promise of recovery. Yes.
Okay. It's 5 minutes past 9 o'clock here on 107.9 FM. Yes, and you're right. If you're just joining us, we're discussing mood and mood disorders. A very interesting gentleman asking a very interesting question, Caleb. He's saying that most of these symptoms you're talking about are similar to broken heart. Arante, we're not talking about broken heart, we're talking about mood disorders.
Well,
A broken heart, a mood disorder.
so am I allowed to express my condolence to whoever may have experienced that broken heart?
We are sorry for all the broken-hearted people.
If you touch a wrong nerve, we didn't mean to remind you of your trauma, but yes, basically, so sometimes, like I was going to say earlier, it's not, sometimes you may have a reason, actually, but then your reaction to whatever the reason is has gone beyond the expected normal response to a sad event. Like, for example, Griffith said, in this case, relationship problem, ongoing, marital problem, financial, something ongoing.
This loss of a loved one.
Yeah.
Loss of a loved one,
Ongoing.
could actually precipitate or be what we call, okay, I'll try not to use the jargon too much, yes. So we have what we call triggers.
Okay.
Or precipitate something, factor, something that will happens and kind of hits you hard, and then it kind of develops the problem. Like in asthma, dust can trigger attack. Good.
Okay.
Then we have what we call the factors that will make it like fuel it to keep going on. Like to perpetuate the thing. So sometimes what triggered it may be what happened, the broken heart. Sometimes to the ongoing crisis may be what we call the factor that is fueling it ongoing.
It's still ongoing. Okay.
So you may think, oh, there's a reason, so it is okay. But you realize that the response has gone way beyond just sadness and has included other reactions and other symptoms. Yes, you will need help to be able to deal with the ongoing crisis. If it is something that probably you can modify, we will help you during a discussion to see how we can modify whatever it is. If it is something which you can modify, but you have to be helped to know how to cope with it and still live the best life possible. We will also help you to be able to cope with the situation better, to live the best life possible. If it's something that it went on or happened some time ago, we are still holding on to it, being the reason for the ongoing mood issue. Especially in case of depression, they will help you to put in a few measures to help you overcome what happened, to learn to put it behind you, to learn to appreciate that it's already done. What's left is like crying over spilled milk. We don't mean to undermine the gravity of what happened. No, we won't just rub it off that it is okay or no. That's not what I mean. We just want you to appreciate the fact that it happened, yes. It was not desired, yes. How can we live the best of what is left of us?
It's good you said that, because you see, it's easy if you are not the one in the situation to brush off, trivialize, your partner has left you and so what? You understand? You have trailed the paper and so what? You understand? But what you're saying is that you don't trivialize the cause. Okay.
Exactly. We will help you too. We do our best to do it together with you to see how we can best help you, basically, to equip you and all that. Yeah. And then one thing too, like Dr. Fala said, most of it, the symptoms of depression are what he says. Sometimes I've had a few people too who they don't think they are sad, but they have the other features. Exactly. Sometimes it's just poor concentration and energy levels have come down. He can't pinpoint any reason, but he's just not as feels down, like he's not as active as before. Sleep, appetite, but if you ask whether he's sad or not, he's not. He will say he's not sad. It's also part of can be some symptoms of depression.
Caleb, how often should people? How often should people get a mental health evaluation?
Interesting.
I'm asking because of what a very good friend of mine has sent me, and you can send your message on 0548 501 584. How often?
I would say if you can do it, if you have no pressing issue, once, twice a year, if it's okay with you, maybe. If there's no pressing issue, but
So
you just want to make sure, find out if there
Everything's
is.
You see,
Once
my
or
very
twice
good
a
friend
year.
is a priest, and he has sent me a message that, and I know, Father, I know this one, you are pushing it, but mechanism. You see, he's saying that in the Catholic Church, confession is a very pivotal part of the faith.
Yeah.
And a lot of the things you would hear at confession, some of the things you're saying, and he sees how people get light after saying what is bothering them and going away.
Yeah.
So he's just asking that, because it's ideal that you do it at least twice a year.
Right.
But he's just asking me to find out from you, like when it comes to mental health, like, you know what, I'm going to see my psychologist, I'm going to see my psychiatrist. How often should it be? At least once a year.
Oh, I would say, like you said, twice. If let's say you are so busy, you don't see it's necessary. Assuming you just pass through once. Sometimes that once will help you realize that I need to pay attention to this. But then, like our priest just said, sometimes if you're not sure about something or it seems to be beginning to bother you, pass through, have a conversation.
Have a conversation about it.
Therapist, psychologist, psychiatrist, or basically a mental health professional who may be close to you.
Okay.
Yeah. Then if there's something which was probably cropping up, or you were allowing something to affect you more than it should, probably your attention will be drawn to it. And I like the way
should go.
I like the way you put it that sometimes for let me just talk to a psychologist.
Yeah.
No, but okay,
It
people are listening at home and they are wondering. You see, when you go to a hospital with
A complaint.
like a pathological complaint, I have a headache, I have back pain, I have chest pain, I have shoulder pain. You know what you're going to say. When you come to a mental health professional,
What do you say?
what do you say? No, you see, I think
Open
sometimes
it.
that the reason
Unveil
why
it.
yes, the reason why people struggle to come to you is that do I just go and say, you know what? I feel too sad.
Okay, see, but that is it.
That's why I came to hospital. I'm sad.
That's the difference between us.
Or I'm sleeping too much.
That's the difference between us and the other physicians.
So the people who are listening, you can come and just say
yes,
what you are feeling at the emotional level.
exactly.
Let me just keep it that way.
Exactly. Just come. We are like your companion for life, And you see, the interesting thing is that they say that when we burn out, we don't burn out because our pay is not enough or our working conditions are not enough. We burn out because you come and you transfer
You transfer
on
your
us.
burden on.
Yes. So I was itching to say that, Father, you are very right. You see, when you have a storm going on, we hope that when we are enough, it can be instead of bipolar being the slang now, the slang should be that, I'm going to see my psychiatrist. I'm going to talk to my psychiatrist. I'm going to see my psychologist.
But from where I sit, let me be honest with you.
Can we get there?
When even people come for medical reports and it has a mental health component, they want to beg you, bribe you, coerce you not to include it. And I always insist that
It should be
that
there.
part is what is going to save your career.
Yeah.
If we write it that you're an attendant at our mental health unit and you're on medication or you're being seen, you're on psychotherapy or whatever, your employer, if they are smart, will pick it up and realize that they need to understand you. But, I mean, between the three of us, how common are mental disorders in Ghana, or maybe Ghana, in Ghana? Because I especially when it comes to mood disorders, like how common is it? Is it that common?
Oh, I would say yes, it is. It is commoner, I would even say more than what probably scientific surveys will show. Because culture, like you rightly said, as a men especially, somehow we still bulldoze through, like people say. And I like that word, bulldoze through. And it is generally for mental health issues in general, disorders in general, our statistics done showed 1 in 4. Like distresses, disorders. I put everything together because it is something which keeps occurring, keeps happening. Yeah, I mean, because of we are sticking to mood disorders, basically, but generally, yes, 1 in 4 would do. Depression, maybe a little less than that, but not too low. I wouldn't say it is so low. Once again, I would say, of course, there are risk factors too that will make it's likely to happen in one situation or in some people more than the other. Risk factors basically, we mean probably someone who has an ongoing stress or stressor issue. Maybe something happened, loss or misfortune or something happened. Sometimes they say that the female gender, so to say, but then basically that's what surveys have shown, more at risk. Obviously, there are hormonal interplays here and there with that. Substance use can also predispose you to mood disorders and many others. Sometimes, when you start using a substance for whatever reason you started using a substance, which is another topic on its own, without it, you feel like you're not.
Pascal.
You feel like you're not. So you may end up going to use more. So aside its risk for mental health disorders in general, it's also unknown. And then sometimes physiological demands, like chronic illnesses, sometimes because of how the individual is processing the ongoing illness, why me, what will become of me, all those things, poses a risk factor for depression. And then other physiological demands, we say physiological demand, example is pregnancy, because it places more demand on the body. That one will also in its way predispose. So it can also trigger a number of mental health issues. The other risk factors, majorly we say genetic risk factors, because even though you may not be able to pinpoint and be sure, say 100%, this gene, if you have this gene, you have depression. But a number of studies have shown that like familial.
There's a family risk.
I'll put it that way, family risk. But it doesn't mean that once your parent has, but that means you to by all means. That's what you're saying. But like I would say, there is that genetic component risk from generational observations and studies and things like that. So, yes, it is common. Some risk factors will make it likely than others, And then maybe just to touch on the other mood disorders too, like especially bipolar, which you are saying. So, just to mention that bipolar, people's mind goes straight to only mood swings. So sometimes, if you have, some people can be okay today, then maybe at a certain period, they are on the high side, very energetic. Sometimes, some people will have what we call the increased energy with what we call technically goal-directed activity, which basically means them to have energy to do a lot of work more than their usual self. For one reason or the other, they can stay up at night, they will read, sometimes they maybe end up washing utensils over and over, clean the whole house over and over again. Sometimes you realize that it is out of the person's usual. Sometimes you may look as such. The ones we have seen, because a lot of times you go on social media and then those are not the only symptoms of the manic or mania aspects of bipolar.
So it's like the person wakes up and maybe it's 2 a.m. and starts washing dishes.
Yes. Which is not their usual.
Exactly.
So, which is not their usual. So, here we are describing the other mood disorder, which is mania. And in mania, just like how I mentioned with regards to the depression, what you find is that your emotional state is increased compared to your usual state. So you are feeling very happy, you are feeling excited, you are feeling like you've won the lottery, you are in a good mood state. And this is above your usual state. So your energy level too, you're feeling like you have a lot of energy. You could pick up a house. You know, you don't feel tired. Okay, you have a lot of energy. And in this category too, your activity level goes up. So it is important to note that people who have mania or who have the manic aspect of the bipolar disorder, they engage in activities that are goal-directed. So they will function. They'll get up. They want to wash. They'll wash it perfect. They want to cook, they'll cook it perfect. They want to clean house, they'll clean perfect. They want to write their thesis, they'll do it. They want to work. There is an increase in goal-directed activity above what they usually are able to do. Now, this state is as if they are awake. They are very awake, so they do not feel the need to sleep. So they can wake up at 2 a.m. and they will be up the whole night, active, going up and down, doing things. And during the day, they will still be as awake as the rest of us who slept our full 4 to 5 hours. And they will not tire, you see. Usually, the human brain requires a good amount of sleep, which we've mentioned. And if you have any deficits, and it's very significant, during the day, you have to pay. You cannot owe sleep. If you owe sleep, you carry it for 2 weeks. But people who are manic may be sleeping 2 hours, 3 hours in the 24 hours.
But you see,
and they will not dose, they will not slack.
Unfortunately, we seem to feel that those people are like those people that we aspire to. Because
To
you
be
know,
like.
yes, when maybe you're in uni or you're in secondary school, Charlie, you see this, your mates.
He's all over the place.
Yeah, like, pam, pam, pam. Like the guy goes to bed at 1 a.m., 3 o'clock, he's up. Carry his books. He's going to mine.
Charlie.
No, you see.
Not to get us wrong, we're not saying that everyone who is...
No, yes, I get it. But I see, where do you draw the line? You see, like, where do you draw the line between this is normal
And this is manic.
this is manic? 0548501584. That's our WhatsApp line if you want to join us. 0548501584. Thanks to those who are listening and drew my attention to Caleb's mic. I think it was a bit low, but we've changed it now, so we're good to go. 0548501584. That is the WhatsApp line for you to join us. I like the comments that are coming in. You see, so now people are realizing that probably the best people, I don't know, and you are the guys in the field, probably the best people to pick up some of these mood changes are probably people who are close to you, your partner, your spouse, your work colleague.
Yeah.
But someone is asking that if I have a work colleague who is like this, how do I tell them?
So, all right.
Yankan is saying.
So, I'll try and address the thin line and then I'll come to that question. So,
Exactly.
The other symptoms, in addition to what Pearl said, sometimes the excitement, you can see, even though scripture says rejoice always, but this level of rejoicing always here.
I know
Sociable all over the place. Once again, out of keeping with the person's usual nature, you have sometimes instead of the excitement, it cannot be with or even only be just what we call irritability or gets angry easily. With even if something which it's sometimes it's annoying though, but the person's extent of getting annoyed with an issue is a bit too frequent and too easily. Out of keeping with the person's nature, sometimes they can actually go about an extreme of easily observable levels, claiming things, including Orange FM is mine. What are you doing here? That's a very grandiose delusions, that extent. But then we have people who are called, for lack of a better word, called workaholics. Some people, if the term workaholic means what I think it means, then it is the very little rest, they are enough. I mean, it's okay with them. Then they are very productive. I would say work a lot, productive and all that. If it's the person's usual nature already, even with that one, we will encourage that to get enough rest, because if you're not careful, to have an effect on your rest, on your health. But in the absence of people who go back college, you realize that this person is not usually like this. That is one of the first signs you should note out for. the person is usually not like this. If the person gets into these states from time to time, they become very workaholic, very sociable, easily getting angry, and after a period of time or weeks, it subsides to a usual level.
Mm-hmm.
One feature about bipolar is the person can have the resolution of these symptoms even without treatment at the beginning. It will look like, what you see in local parlance, but, and that is what we realize a lot of times, people who have come on social media who had bipolar, realize that at a point, it goes down, then later on, it seems to come up high again. What we call the bipolar means either periods of mania, as you described, with the in-between, they are very normal and very functional, in between the episodes. They can switch to very okay levels, but then when the episode starts, they have these symptoms you described. And then if we have the periods of the mania interspersed or mixed with the periods of depression, that's also called bipolar. Good. So the person can have these manic phases or symptoms like we've described. Sometimes the manic phases will also include person can become flirtatious, hypersexual, increased libido. And unfortunately, some people are taken advantage of in that state because the condition will make them prone to wanting to have more sexual activities. Exactly. Sometimes, like people said about generosity, can dash out money a lot. They can withdraw from the bank a lot of money and spend a lot.
And just go and blow the money.
Oh my goodness. And then, like I said, sometimes when it can go by itself and they regret what happened. So when it comes to therapy, we talk about advanced directives later on.
Yes. So I mean, just to bring this into the conversation. So, social media now is awash with people who, for me, and I'm sure for you, you see their posts, their videos, their comments on social media, and you can tell that there's something that this person needs help with. Now, a listener wants to find out that when you find, and he makes, he names certain examples that I cannot name, but he's saying that when you find an individual, like a social person, I don't use the word celebrity, I say we don't have celebrities in Ghana, somebody who is socially well known, doing something that even the untrained mind and eye knows that there's something, I don't want to say wrong, but there's a challenge here. How are you supposed to address it? Like, how do you address it?
So, in line with what the other person also asked, when it's a colleague and when the person is socially known, I would say, first of all, if the person is a colleague and you're close to the person, approach the person. Tell them, of course, it's not like going straight to the topic. I mean, you're conversational with the person. So you can throw in a conversation. But it's like nowadays, you get money. What's up? You
win some lotto.
Then they may open up. In fact, they may not open up, but they may respond with something that will show that, after all, what is money meant for? You realize that, no, this is not my friend's usual self. Then you can ask conversations in line with the other symptoms we mentioned. If the first friendly approach, you can conclude by saying, do you mind us talking to someone who I think probably may be stressed or there's a change in you, and I don't want it to get worse, if you don't mind. I'm not saying you have mental health illness. Let's be sure so that things don't get out of hand. Let's go and talk to, you can say, a friend, Dr. B. You can put it that way. Who will check your vitals and then see in a simple way. Then if you have a friend or a mental health worker, or you've gotten a contact or something, you can talk to the person. A lot of times, we are overwhelmed with this request, but we'll try our best. There are a number of us to maybe you reach out, then we'll have a conversation with the person in the clinical setting. That's a normal conversation. If your approach fails, you can use the person. Obviously this person is heading to a dangerous zone, you can involve a superior at the workplace. But it shouldn't be like you are reporting the person to get sacked or to get punished or anything, to help the person with that mindset. Sometimes if you are close to the person's spouse, I'll leave my counselors to talk to. If it's okay, if I'm very close to the person's spouse, I think your spouse, I don't know, I've observed something. Do you mind? Sometimes the person's spouse too may also have noticed it, but was waiting
for somebody, like for an external person.
Then, once again, like I say, I'm not saying go behind people's spouse, then to go and talk to their spouse. But sometimes workplace, sometimes a church leader, in church, or a friend. Not once again to also go about spreading people's issues. But if your first approach fails, and there is another close person, basically what I'm trying to say, if the other close person too, then instead of spreading, or maybe advise someone who the person listens to, a superior, that the person submits to. In this case, the person is going towards dangerous zone, so you're acting the person's best interests. Once again, maintain that clear motive. And then sometimes workplaces have called or arranged for them more like it's an instruction as your superior for your own good.
For your own good.
Some people come and they realize that it was good their bosses forced them to come because they later come to accept that they don't know this and this. Some people, it takes several weeks or months for them to accept. They keep going and coming, keep going and coming. You let them keep going and coming. From time to time, some will definitely give in. Sometimes, unfortunately, they don't give in until it gets very bad. Then they have to be, by appropriate legal means, forced to come in. Of course. And then for the social media people, if I can I would say I'm not too much of a social media person. Yes. But the few I've seen, if the person is okay, maybe I don't even have anything to tell social media people.
So I think that it's a similar approach with the social media people. This person is on the same platform with you, so you have a relationship with the person. And so you are able to tell that this behavior is a deviation from their normal range. So like what he's saying, establish that contact, establish the rapport with the person. Privately message the person and say, hey, I saw your post. What's going on? Is everything okay?
Is everything all right?
Would you want to talk with me? Can you share with me what is going on? So establish that contact by this introduction. Build the person's trust. And remember that this job or this function we are playing for each other is the move we are talking about to protect each other's mental well-being. So make the move. Contact the person, private message the person. And it comes with a responsibility. The responsibility is to provide confidentiality and privacy for the person. Otherwise, then I would say don't start. Because the point is to be a source of support and help. So if you start,
it means you are committing yourself
to
go with the person.
Yes, this is the move we are talking about, that each of us should make a positive move to ensure we all collectively have good mental health.
You see, what you said is very important. Because you see, what I find is that when it comes to mood disorders, mental health, mania, bipolar, when the person is a socially recognized person, sometimes other people get in just for the sake of getting in. And then halfway, sometimes not even halfway through the journey, they abandon the person.
Yes. And that doesn't help. It doesn't help at all.
So if you have a work colleague, a partner, a friend, and you identify that there's a mood disorder, like there's a challenge with the person, as soon as you step in, you should know that
you are committed.
You are going 100%.
Yeah. If you can commit, then you now hand over to somebody who can commit. And we prefer if that is a mental health professional. Yeah. We're actually advocating for setting up of things like employee assistance programs. And the we should be GHS is actually looking at it, because I know that some 3-4 years ago we had some training for we have to
today's was Saturday.
Resources.
Just on Thursday I attended a workshop held by Patients' Rights Watch. Good morning to you, lawyer Isaac Giabo. I think you'll be here next week. There was a revelation from the Medical and Dental Council registrar.
Yeah.
That during the course of the year, last year, the number of mental health related queries that came to the Medical and Dental Council about medical doctors.
Yeah.
You can bring in the statistic. It's not pleasant.
At all.
So even for us who are taking care of people who are not well, some of us have huge mental health issues. So I like the fact that, Pearl, you are saying that if you decide to go and intervene, don't also do it for the popularity.
No.
Do it because you genuinely want to help the person.
Yeah.
And don't take advantage of the person.
Don't do that.
Because, Caleb, I think you mentioned that I've heard before where, especially for the females, where they become hypersexual and somebody steps in to help and the person takes advantage.
And children are born as a result. You can have people with 5 children, different men. So the implications of mood disorders, we can't even finish talking about it today. So like we are talking about, make the move, establish the contacts, build the trust, provide privacy, provide confidentiality. If you can't go the whole haul, hand over the person to someone who is trained to be able to provide that support. And let's let the person get help. Let's build our system. So our employee assistance program, I know former Metro director was working strongly on it. We need to actually revamp it. And I think not just have it in the health sector, but have it in all the corporate institutions. It is a move that we need to make for our human resource mental health. And we need to look at putting in place. And in fact, there's a bad aspect to the current existing systems that it comes as queries. We write a query, then they respond to the query. Then we write a query, that's not doing anything. So once the first query comes, we need to put a count on it. By the 3rd query, there has to be a committee set to sit down and look into the case. And it should not be a victimization attempt. It should be an attempt to help tease out symptoms, help the individual recognize that they have deviated from who they themselves know themselves to be. That is helping the person gain what we call insight, the awareness that you are not yourself. It's as simple as that. You are helping the person realize that they are not their usual self. And once you get them to recognize that they are not their usual self, you are helping them to begin to move towards getting help. And once that is established, then in fact, there has to be a management plan put in place to get them to recover. And we also need to understand that when we are dealing with mental health conditions, we are not talking about conditions like malaria. So it's a 3-day course. You are taking medication at time 0, 8 hours daily for 3 days, and you are done. No, we are talking about the brain and its associated structures.
So what's the minimum in your estimation? What's the minimum time for treatment? Minimum?
Depending on the condition, you might have resolution of symptoms beginning to set in at about 2 weeks. With appropriate dosing. About 2 weeks, you should have your symptoms coming down and you being more comfortable. But for the timeline for recovery, even for conditions like simple anxiety disorders, we might be looking at 3 to 6 months. Okay. And if you have gone beyond moderate and severe, I would just say, based on the other factors that contribute to the mood disorder, because you see, we acknowledge that there are genetic factors that are contributing. We acknowledge that there are physiological factors that are contributing.
And
say,
also environmental factors.
And there are environmental factors, interpersonal factors, you know, your boss and your relationship stresses, your financial issues stresses, food prices stresses, your landlord stresses, okay, your career goals, frustration stresses. So whatever the issues are, which are environmental, that your interaction with your psychologist are working at resolving. When the resolution hasn't come, then putting a timeline to your recovery can be very tricky. So the goal with management is to get you back at your normal level and functioning with less distress. And the key is that you comply to the management plan that has been outlined for you. And be patient with yourself. Give yourself the time to recover, which includes making time to rest, making time to eat well, making time to have healthy social interactions. You know, people who are feeling depressed socially isolate themselves. They don't go for church gatherings. They don't talk to anybody. And all those do not induce your body to produce the positive compounds that help improve your state. So even pushing to eat when you don't feel like eating, all these things are positive actions that you should put in place to help you recover. Okay.
So let me announce the phone lines now. 0541 022 318 0541 022 318. You can call us and share your thoughts, your questions, and your comments with us on 0541 022 318. That's the line that you can call us on. I know when we're talking mental health, where people are a bit sensitive, don't worry, you don't have to mention your name. I'm okay with that. 0541 022 318. So there was a question. You see, I wanted to find out. It's not just about the timeline. You see, for employers, probably this is your most hard-working employee who now has a mental health challenge and has to go off for 6 months. Is it essential that, you know, and I want us to be realistic here, within the scheme of things.
How do we deal with that?
Obey anything.
Yeah, so...
your best teacher, your best medical personnel, your best radio, like 6 months.
So, Kwesi, what I'm saying is not that 6 months out flat there in the house.
Okay.
What I'm saying is that from 2 weeks, you should begin to see improvement. So typically, in the very acute stage where there's severe symptoms, we usually would recommend that you give at least maybe some 2 weeks rest where they are relieved of essential responsibilities. And they are getting time to take their medications, because this category means that we are bringing in with medication. They need to be going for psychotherapy as well. They should be getting social support as well. So if they are the sole breadwinner, they are the only person in the house doing all the house jobs, this is the point where a relative needs to come to the house and stay with you in the house and to be helping them around the house. So if they are the workplace to, maybe if they are playing essential functions, you want to get someone to assist them. Or even in the worst case scenario, say, you know what, anything else is not as important as you are. Just take the 2 weeks and try and get things normalized. So after 2 weeks, usually we'll do a review and see how they are doing. If they are in the mild category, by 2 weeks, they themselves will be telling you, I want to go back to work.
Okay.
Okay. If they are in the moderate and severe, 2 weeks, they might still not feel too up to it, but they might themselves be feeling guilty. The beautiful thing about people with mood disorders is that it's not like schizophrenia, where when they are psychotic, they have lost touch with reality, so they can't do anything. And you remember that when we talked about even their activities, goal-directed, so they are productive. In fact, when they are in the manic states, they are more productive than your average person. Is your depressed person who will not be productive, okay? And so they come to work and they will not do any work. So whichever group they are in, it is good at least you give them some rest. So the manic one will not sort of get exhausted and just collapse on you, but they get the rest. So after 2 weeks, you want to review them. If they feel they are up to the task, you can give them a trial. Let them come back to work because the activity is helpful. Give them some responsibilities. Give them the support at the work place so that they can perform some functions, and it helps build their self-esteem as well. It's good for recovery. Okay. So if after the 2 weeks they come back to work, you see how they are functioning and they are doing all right and they want to continue. Let's say they might not be the sole on-call person. So if they are a doctor, they might not be like the specialist on duty, but they are on the duty roster.
Yeah,
so you expect to see them at the consulting room, and someone should be the body to the person. There should be someone who is at the workplace who's like their go-to person, who is checking to see how are you doing, is it okay? And if they do come back to work, they see 2 or 3 cases and they feel, no, I don't think I can go on. The support they need at the workplace, they say, it's okay, yeah, you can go, we'll pick up the workload.
For you.
Okay, and then you support them until the time when they are full capacity. So they are not completely out of the workplace. They are there. You modify their responsibilities so that when they are back, they pick up from where they are and they move on.
0541022318, 0541022318. Yes, you're listening to Dr. Caleb Otu Ansah and Dr. Pearl Nyako. They are both at the Confounders Teaching Hospital, psychiatry or mental health department of mental health. Mental health is a lot, and they have a lot on their table. Caleb, I'm going to ask you a question because I know you are a man of religion. You can join us with your calls or comments on 0541022318. Someone wants to find out that, would you agree that it's about time that we gave people of the cloth, people of the Bible, people of religion, some training to be able to pick up some of these things? Because he's saying that therapy for mental health, he knows, takes a long time. But he's also aware that therapy for mental health is often interrupted by spirituality.
Thank you very much. Spirituality and faith interplay is something which is as old as, who knows, even in scripture. I think at a point Paul said, I think 1 Corinthians also, that he despised of life itself. He was talking about some of the travels, and he was pressed hard. Challenges he faced. And he used that phrase, one of the versions, I think KJV also. He despised of life itself, but he got reassurance.
Okay.
So he got psychotherapy.
I see.
From God, from his faith in God. So you can be a Christian doesn't mean you wouldn't face one challenge or the other in mental health. Okay. Facing one challenge or the other in mental health will not make you less of a person of faith or a person of... Yes. The handling is what I will encourage, that, like the person rightly said, we approach it with both aspects or from both perspectives. So I keep telling people this, that, excuse me to say, if there was an accident and someone popped up from nowhere and said, hey, me, I'm the witch who caused this accident. The person is exsanguinated. Will you say because someone has accepted that they are witch who caused this problem, therefore you watch the person bleed to death, or you rather carry the person to the hospital and pray alongside? Definitely you carry the person to the hospital for the bleeding to be addressed, and you're praying alongside. If you are a student, will you use all the time to pray, and not read? Definitely not. You do both. If you are an accountant in a firm, will you say because you believe in God, you apply the correct accounting principles, and you only pray and squander all the money and expect a miracle? No. You apply proper measures physically, and you pray in addition for your firm. So using both ways is not mental health. It's not an exception in this area. I salute our spiritual leaders, my own apostle, Professor G.I.T. Boete, and all our leaders. They are doing well. Some are doing well when it comes to balancing the two. A lot of spiritual leaders will actually refer them clients to mental health professionals. And thumbs up to that. We'll encourage that they do it that way. Do the counseling bit. And then obviously, the person should be referred when the need arises. Of course, you keep on praying for the person, but then there is an aspect of them of physical intervention. And the definition of miracle is that, when God has put in the principles, the scientific and other principles he set in motion, it's supposed to be used. Then when there is an interference supernaturally from him, then it's called a miracle. So in other words, the order of the day by God himself is to set in motion the principles which you're supposed to use in psychotherapy, in pharmacological therapy, and all that. Then we trust him to help. So you don't put just aspects of the physical principles that are necessary aside and do only the spiritual. I don't think it's biblical. Combining both of them, exactly, is, I would say, the way to go. And we want to encourage that. In fact, there are a number of projects that seek to go to some of these prayer centers to encourage them that, people will keep coming to you, whatever we say, but know the limits and know the need to involve mental health professionals.
Like, know when to say, this one, yes, we will pray for you, but we will still ask you to see a mental health practitioner. It's important. Good morning to you, Pasolo. So you're doing the listening from live inside Confanochi, and anybody else who is listening at Cath, at home, in their cars, in the various hospitals. Good morning to my own staff at Mampong Hospital. We have just about 8 minutes to go, and I know there's a question you're itching to ask. 0541 022318, 0541 022318. A lot of people are listening, and you know what? Yes, we are doing mental health awareness, but how I wish, I know your boss is also listening. I know your boss is also listening. How? Yes, I know your boss is also listening. How I wish that we would,
continue this.
No, like we would just pick one mental health condition to make noise about every month of the year. So at least in the year, we've done 12 mental health conditions. Because you see, my challenge is that we make noise during the month and then we go to sleep until the following year. We make noise during the month and we go to sleep until during the year. It's only when a celebrity or somebody who is popular has a mental health diagnosis, then they call all the pseudo experts who don't know anything about it to talk about it. No, I mean, sometimes people will call me about it, and I'm like, you know what? I'm a family physician. I'm not a psychiatrist. I'm not a mental health person. I'll send their numbers to you. Call them and get proper understanding. Anyway, 0541.
We'll consider it.
Please consider it.
So I think, there are this, what we call bipolar man, schizophrenia man.
Yeah.
So those things are there.
We should do it.
Yeah, exactly. Actually, there are some of them are even global. So like epilepsy man, those things.
Yes, we should do it.
Maybe, having said that, when the month is known, maybe, we actually do them already. Let's say schizophrenia month, we'll talk about it. We may organize one seminar or the other about it, the various things.
I think Dr. Jima is saying that because he's brought this discussion up before.
Okay.
He actually tasked us to plan a year program and then send him the dates pointed out. So, Doc, we'll work on it.
Please do. Please do. I need it.
We'll work on it.
It's great. So, one of the questions that I have here to ask is that this is quite a general observation that someone is making, that very often when it comes to people's mood, someone closer to you is able to describe the mood. Yeah. However, it becomes very, very difficult for people to accept external judgments, in quotes, of people's mood. So I have seen Caleb. I know how he is. I realize that things have changed. I may tell him, but he's like, I say, I mean, you are not the one to tell me I have changed. How do you go around telling somebody who knows that they have changed, like their mood has gotten worse, or they may have a condition? They know, but they say like, you're not the one to tell them. So
this is one of the very good attributes of psychologists, and it's one of the things we do. You could apply several techniques, including techniques like reverse psychology. So by that, what I mean is describe what you have observed, okay, and ask the person whether they acknowledge that they used to be like this, and then describe the current states, and then try and see if they can recognize that this new form of their state is also valid. Usually when you take them through a listings of your observations and they acknowledge them, by the time you are done with it, they would begin to consider that it is possible that they have changed. In fact, these kind of changes can be so subtle that you yourself might not recognize it. I must emphasize that there are some mental health conditions where these aspects of self-awareness we are talking about is the aspects that is affected in the condition. The good thing is that most of the time in mood disorders, that aspect is intact. Okay. But for some other mental health conditions, that aspect of your self-awareness is what is affected. And in those instances, then the person will vehemently deny the change. But good news, if it is a mood disorder, they will acknowledge the changes. Like you tell them, how's your sleep? And say, well, they themselves will tell you, no, I'm not able to sleep. I don't sleep at all.
Okay.
How's your appetite? Say, nowadays I can't eat too much. Are you happy? Say, no, I'm not happy. How's your energy? Do you feel that you've lost energy, or do you have your usual? Say, oh, nowadays when I do a little bit of activity, I'm tired. I can't go as far as I used to. So with mood disorders, they will actually tick the boxes for you. So by the time they've ticked the number of boxes, then if you tell them that, yeah, I've also noticed the same thing, I think that we have to talk to somebody, they will actually come along. But the other mental health conditions, specifically like schizophrenia, which can come with a form where there are mood symptoms, the type we call schizoaffective disorder. That one, they will have these mood symptoms we are talking about. But in that condition, your awareness of self is impaired. So that category of presentation, they will deny. And in fact, most of the time, you have to be tactful before you can get them to get help. So this is just a flag I'm raising here, that if you notice significant change in someone you know very well, and they seem not to be aware of the change, it is actually a red flag. You need to get them to talk to a professional, because they might be suffering from a more chronic and a more severe form of mental illness that needs attention.
And that brings us to bang on 10 o'clock. It's impossible when this happens, but that's how it is. And that brings us to the end of our show today. Guys, any final words? I'll start with you, Caleb, before we run out of the studio.
All right, thank you very much. So thanks to our audience once again. Mental health is spectrum. Mental health conditions are manageable. Something can be done about it. Once again, I end on saying, like I usually do, you have a purpose in life, and we want to do our best to partner with you to do that, no matter the challenge that comes your way, even if it is mental health. Mental health, we have something we call protective factors that aid you or help you in your recovery process or minimize the risk of making it getting worse. One of them is awareness that there's an issue and coming to accept it. I was going to say that in balance, local balance, we say, it's one thing that I personally used to guide myself so that people, at least close people, can come to me when they notice that something's going on, because neutral crying is in the chia, and it will help me, even in the absence of any illness, to do the best I can and live the best life I can possible.
Great. Pearl?
Yes, I think I want Caleb's statements to linger on. That the whole point of moving for your mental health is that there is some value in you, and we are your partners to help that value to be optimized. So please, let's get help. Let's work together to make it possible. And probably you've been listening to us and you want to make the contact. I'll put this number out, 054 659 2555.
Can you repeat the number?
054 659 2555.
Okay.
Please call and share your need, and let's look at how we can work it out for you.
That's great. And that brings us to the end of another Saturday here on 107.9 Orange FM. We're back on your radio next week, Saturday, from 8 to 10 a.m. And next week, we're beginning a series on medical negligence and patients' rights. You don't want to miss that one. As always, my name is Dr. Jima. Enjoy your Saturday. The rains have kind of stopped now, and stay safe out there. See you next week.